Well, the number one complication is actually not a complication but a side effect, which is capsular contracture. So that the body's reaction to the implant is that it gets hard. And actually that's manifested by that room that we talked about that's made for the implant by the body starts squeezing down or forming scar contracture. The most common cause of this is contamination of the implant surface, either at the time of implantation or years later from an infection that you've gotten, anywhere from a cold to an infection of the breast milk or your cut or whatever. So then the body doesn't like it and starts contracting. So that's happens anywhere from 1 to 5 to 6% depending on the type of implant and whether it's placed behind or below or in front of the muscle. So that, like I said, that's less of a complication than a real possibility or side effect. The complications that we always talk about in any kind of surgery is bleeding and infection. Bleeding actually in my hands and in most skilled plastic surgeons' hands in breast augmentation happens in 1 in 200 to 1 in 400, and infection probably around the same amount. The position difference, the more you study the shapes of the breast being slightly different, the more you realize that more than likely a positional difference in the implant themselves is more related to how big the skin pocket was than to anything going wrong with the surgery. But that's another one that can be considered a complication, which is a malpositioned implant that you have to adjust.